Good morning and welcome to Crush Cravings Before Diabetes Crushes You. And I'm sorry I haven't been here in 4 weeks. I've been sick and I'm still a little bit sick, but I'm going to muddle through, and so please excuse my raspy voice. It is what it is. It's one of those things that just doesn't seem to want to go away. Anyway, enough about me. So today what we're going to do is we're going to talk about one of the things that has gotten a lot of buzz lately in the media. A couple of days ago, there was a special on TV by Oprah Winfrey, who is the voice of many people. And so she was talking about the use of certain medications in her pursuit of weight loss. Now, if you followed Oprah for as many years as I've known about her, 25 or more years, you know that she struggled with her weight throughout that entire time. And she was very public about it. At one point, in fact, she mentions this in her special. At one point, she had gone on some sort of a liquid diet. I can't recall the name of it now because whatever it was gained great popularity after she announced that she did it. She had lost 60 pounds, put on her Jordache jeans, so that you know how long ago that was, and came out on stage with a wagon full of 60 pounds of fat so people could get a visual of what losing 60 pounds looks like. Then she said the next day after that special, after that particular program aired, she started gaining the weight back. And she had yo-yoed ever since. She joined Weight Watchers, got on their board of directors, was a major stockholder, and influenced a lot of people to join Weight Watchers because she's very influential. She's one of the early influencers before the YouTube and the TikTok and all the other social media platforms were ever even thought of. But she can move the needle on anything that she talks about. So she joined Weight Watchers. A lot of people joined after her. And then she followed the program. She may have lost a few pounds, but she didn't seem to keep it off. Then all of a sudden, she decided that she was going to, and I don't know all the complete details about this, but she decided she was going to use one of the drugs that are originally designed to treat diabetes. But one of the side effects of the use of this drug, of this particular class of drugs, is weight loss. So not only has Oprah done it, but many other celebrities have done it. Now, Oprah had a significant amount of weight to lose. She looks like she's lost a significant amount of weight. She doesn't look underweight. She looks healthy. And so I say, good for you, Oprah. You know, she finally got where she wanted to be. She's 70 years old. As you get older, it's very difficult to lose weight. Or it can be very difficult if you don't have the right formula. But there are other celebrities that have done it for 10 pounds, 15 pounds to stay gaunt looking. And I don't think that that's a really good, first of all, it's not a really good example to set for people. It's also not really good for your body. So I'm going to dig in a little bit today about the use of these drugs. And there is no judgment. There's no judgment about this at all. There's some people that absolutely need them. There's some people who may take them as an easy way out. But whatever your choice is, or you may decide that you're not going to use them. After we have this conversation, and you get a little bit more information than maybe you had, maybe you'll make a different decision. So let's talk about it a little bit. So I just want to, I have a bunch of notes here because there's some long words and some scientific stuff I want to make sure I get right. So please excuse my use of notes. I'm going to use notes almost every time I talk to you because I just want to make sure that I stay on track and I am giving you the right information. So, excuse me. So as I said, this has been a trending topic lately where many people have decided to jump on the bandwagon and use these drugs to help them with their weight loss journey. Unfortunately, a lot of times insurance isn't covering it unless you're diabetic. So it is a sizable price tag because a lot of these things are still fairly new in the market. So they still have patent protection, which means that they don't have any competition, or they don't have a lot of competition. They don't have generic competition, let's put it that way. And so they can charge a hefty price tag for them, and they do. So it can cost $500 to $1,000 a month, depending on what you're using. And another trend that's happening is some of these weight loss centers are doing compounding with I'm not exactly sure how it works because I'm not a scientist, but compounding is when the medication is mixed outside of the pharmaceutical company. And they're mixing it with other things. They may be mixing it with vitamin B. They may be mixing it with who knows what else. But when you're using a compounded product, the dosing may not be consistent, and you don't know what else is in there that may react in your body differently than just the medicine itself. So that may be a little dangerous. It's a less expensive way to go because you can get the medication for less money, but it is probably not the best choice for people. So I come from a position of do whatever you can without medication before you go use medication as a last resort. I don't like to have medication as the first line of defense. Not because it's an easy way out, not because I'm some sort of whatever holier than thou. It's just that I feel like your body's innate ability to heal itself if you give it the right tools is incredible. And so giving it the right information and the right tools to do the job that it's meant to do, you may not need the medication. So that's really where I come from. But if you feel that that is your last resort, I say go forth and take your medication. But also I would encourage people to, if you decide to do this, and I'm going to give you some more information about this stuff, but if you decide to do this, make sure you're also getting the support that you need. Because if you are just taking these drugs to suppress your appetite or make you so nauseated that you can't eat, or whatever the reason is, or whatever your thought process is, you became obese or overweight for a particular reason, whether it is emotional, whether it was trauma-based, whether it was due to other medications that you're on, whether it's even if you have a genetic predisposition towards being overweight, you don't have to flip that genetic switch. So if it did flip, if obesity and being overweight is something that is a familial trait, it probably, your body, everybody's born with a particular body type, and not everybody is 110 pounds soaking wet. But when you are overweight and obese, often there are underlying things that cause that. It may be poor food choices, it may be a sedentary lifestyle, it may be a lot of stress, it may be a disease state that you're in that you're not aware of. It could be a number of things that cause your body to hold on to weight. But when you're making the decision to lose the weight that you need to lose, you really want to take into account a lot of different things. And one of the things that I would urge you to think about is your health in imminent danger? Are you so overweight or so obese that now your heart is being affected, that you have developed diabetes? Certainly if you've developed diabetes, that's a whole different conversation. Is it inhibiting you from functioning in a real life, in a normal life? If you are in a situation where it is dire, then that is a consideration that needs to be taken into account. But these diabetes drugs, there are a couple of classes of them, and I'm not going to get really scientific about it. There's number one, I can't. I don't know how to do that. I don't know enough about the science. But also, I'm not a medical doctor, so I can't give any medical advice. I never, ever advise people to go off of medication. What my job is to help people to avoid having to take medication by making the changes in their life that will allow them to reduce their blood sugar danger, their risk for developing diabetes, keep their blood sugar under control, keep their cholesterol under control, keep their blood pressure under control, keep their weight under control. That's my job. My job is to help you develop the tools to do that. But if you are in a situation where a doctor has deemed you in need of taking medication, then absolutely do what your doctor tells you to do. I also would advise you to question and ask questions and go into it fully informed and as educated as you possibly can. Don't allow the doctor to give you the brush off because he has to see the next patient. Go armed with your questions and make sure that you're getting the questions answered that you need. So let's talk about these drugs. There is a class of drugs called the GLP-1 receptor agonist. That means that it helps your body to recognize an insulin. GLP is a hormone that provides you with the feeling of satiety. Your stomach is full. It helps you to keep yourself, it regulates your blood sugar. It helps to regulate your insulin sensitivity. And so these drugs, this particular class of drug, this GLP-1 agonist, assists the GLP-1 mechanism in your body. And it acts like the key to a lock, essentially. So the drugs that fall into this category are liraglutide, also known as Victoza and Saxenda, and semaglutide. Semaglutide is Ozempic, Rybelsus, and Wegovy. Now the different names only are just, they are named differently for different uses. So Ozempic is used for diabetes, while Wegovy, I believe, is used for weight loss, and Rybelsus is probably used for both. But it really has to do with the dosing, the size of the dose. So it really, it's the brand name, the market name versus the generic name. It's really, it's just whatever you're familiar with. Liraglutide is, I told you, Victoza and Saxenda. So what they do is these drugs, they help to lower your blood sugar, or they help to lower the rush of glucose into your bloodstream, so that you don't have the fluctuations of blood sugar, and it keeps your body, it keeps your blood sugar from elevating. But a side effect of these drugs is that they help you to lose weight. So a lot of times, like people have found, the discovery has been made that these drugs help you to lose weight. And so people who are maybe not so overweight are asking to get these drugs. One of the problems with this huge demand for these drugs is that the people who actually truly need them to save their lives don't have it available to them, because there's a shortage, because the demand cannot be met at this point. So a lot of times people are going without their drugs, or they're having to take drugs that are less effective for them, because the availability of these drugs is not there for them. But the people, what happens is when you take these drugs to lose weight, there are many side effects from them. And because, let me find my note here that tells me. Some of the side effects actually are gastrointestinal problems, nausea, vomiting, elimination issues, diarrhea, constipation. There are a number of different, really unpleasant side effects. Muscle wasting. There are, so many different things they can, and on a rare occasion, they can cause medullary thyroid cancer. So if you have a history of thyroid cancer, you definitely don't want to take these medications. You also have to know that there isn't a lot of information on long-term safety, because as I watched this Oprah special, they were interviewing a doctor from the Cleveland Clinic, a couple of doctors from the Cleveland Clinic, and they said that the likelihood of you ever going off this drug is very slim. So if you want to maintain the weight loss, you have to stay on the drug your entire life. Now that becomes pretty pricey until it goes generic, or until insurance realizes that obesity is a disease and needs to be addressed as such, and medications should be available to treat said disease. But in the meantime, the cost of these drugs is prohibitive for many people. And they don't know the downstream effects in long term. And what happens is, when you rely on medication to stop you from eating, without doing any of the inner work, any of the psychological work, any of the emotional work, you're not helping yourself necessarily. And that doesn't mean that you're making better food choices. It just means that you can eat less of it. But if you're eating food that is not nourishing you, regardless of the volume of it, you're not getting the benefit of the food that you're supposed to be getting. So when you are relying on something other than yourself to make the choices, or regulate your intake of food, then you're still not learning what you need to learn. And that's the problem for me. For me, I personally would only take medication to lose weight if my health was in imminent risk. So if I was immediately in trouble, where I'm about to have a heart attack if I don't lose the weight.
Let's go back, let's go back. quarantine. Ain't no psychiatrist, ain't no doctor with degrees, but it don't take too much time to see what you're doing to me. You better think about what you're trying to do to me. Yeah, think, let your mind go, let yourself be free. Oh, freedom, 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 oh, freedom, yeah, freedom, now freedom, 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 oh, freedom. Hey, think about it, think about it. Ain't nothing you could ask I could answer you, but I won't. But I was gonna change.
Then I might have to consider it. But unless there's education or support of any kind that goes along with that, you're not going to change anything. You're not going to change the choices in food that you're making. You're still going to choose the foods that got you where you were. You're just going to eat less of it. But those foods didn't serve you. Clearly, they were not your friend. But also, there's a psychological component to weight gaining and weight loss that a lot of people don't realize. And as you lose the weight, that's an emotional coat of armor in a lot of cases. And when you lose the weight, that coat comes off, that suit of armor comes off. And now you feel like you're exposed to the world. And that is really a very interesting phenomenon that nobody talks about, or at least I've never heard anybody talk about. When I was much larger, I was very self-conscious of my size, of how I moved about in the world, how the space that I took up, if I took up too much space, if I was encroaching on someone else's space, all of these things. And when that suit of armor came off, I felt insignificant in the world. It was a very odd thing. I felt very small. I'm not very tall. I'm less than 5'3". So I felt very small in the world and vulnerable. And I was treated differently. And I think that is a story that many people, very overweight people, come to realize when they've gone from being extremely overweight to what would be considered a normal size. And when that happens, they realize how differently they were treated. Well, they already knew how they were treated as an overweight person, but then they find out how they're treated as a so-called normal sized person, and it can be infuriating. You're the same person. You're the same person that you were when you wore a bigger body, but you were treated with disrespect, with dismissiveness, with contempt. I had a doctor one time because my weight fluctuates. I'm up and down the scale still. I still I don't struggle with it, but I deal with my weight fluctuating. But I know exactly why it does. Sometimes I eat too much. I usually make the right choices, but maybe too much of the right choices. But I had gone to a doctor in the last couple of years, probably 3 or 4 years ago, and my weight had gone up maybe 15 pounds since the last time she and I had spoken. And when she weighed me and she came out, she found that number. Now, she was stick thin, like emaciatedly stick thin. She looked at me with this look of disgust. And there was no word that was said. She just looked at me. When she read the number to me, looked at me, and had that look of disgust on her face. And I changed doctors. Because there is no place for someone who is supposed to be supportive of people who are going through such things to judge them. When I work with my clients, there's not a story they can tell me about their own behavior that I probably haven't had done myself somewhere along the line. And it's really about them empowering themselves to make better decisions that are going to be more supportive of their good health. But it doesn't do anybody any good to be judged. All that causes is shame and humiliation, and increases the likelihood that they're going to fall into that spiral again of eating and self-loathing, and eating because of the self-loathing, and then self-loathing because of the eating. That whole circular dynamic is very dangerous. So really getting the support that you need. And I have seen, from other people that I know, that bariatric doctors are not always the most sympathetic. Because when you go to a bariatric doctor for, say, surgery, for bariatric surgery, and you don't lose the weight in the way that they think you should be losing it, or you, again, haven't gotten the education or haven't gotten the support that you need, so that your weight may not change in the right way. And they can be very judgmental. Because a lot of doctors even think that all you have to do is put the fork down. Well, that isn't quite true. It takes a lot more than just putting the fork down. So when you take drugs, I guess the bottom line is, when you take drugs, but don't get the help that you need, it's no different than if you are an alcoholic and you stop drinking on your own, which, maybe some people can do that, but without the support that you need, you're much more likely to relapse. And when you go off of the medication, some people have to go off the medication because of side effects, because of the muscle wasting. Hair loss is another thing. There's extreme nausea to the point of like rupturing something. So if you have to go off the medication, you've not gotten any of the support that you need, you're going to go right back up. You're going to go right back up, and if you have to rely on that medication for the rest of your life, what is the downstream effect of that? What is the long-term effect of that? They don't really know yet. Because those medications they've been around for 20 years, but they haven't been around for 50 years. And what happens 30 years from now if you're still on that medication? What's going to happen to your body? What happens if you decide to have children? What's going to happen? Like, what does that do to your pregnancy? What does that do if you're a man taking it? What does that do to your sperm? I mean, what does it do to, how does that change things in your body that can't be unchanged? Anytime you introduce a foreign object or a foreign substance into your body, there are effects from that that are unintended, and not everybody has the same side effects. So to the extent that you can avoid putting things in your body that don't belong there, or that are not naturally part of what we're supposed to be consuming, you're better off. And I'm not suggesting that you don't take your medication. I'm not saying that at all, because if there are medications that you need to stay alive, there are many medications that are quite effective at keeping people alive, or improving their quality of life, or overcoming an acute situation. There are many drugs that are beneficial that way. But when you have a chronic condition that has been brought on by lifestyle, by environment, by food choices, by lack of sleep, by lack of exercise, by overwhelming stress, if you have a condition like any that I described, unless you get to the root cause of the problem, you're never going to actually take care of the problem. You're going to mask it. You may be able to keep yourself from eating too much, but at what cost? What does that cost you? What's going to happen to you if you decide to go off that medication? What's going to happen to you if that medication no longer works because you've become, immune to it, or whatever happens? Some people have to switch up the medications because they no longer work for them. But if they're not getting what they need, if they're not getting the support that they need, and that medication stops working for them, and they can't find a substitute medication, or they can no longer afford it, or the medication has had its way with them in whatever way that is, and now they can't take it any longer, then what happens? Have they changed their relationship with food? Have they made the right choices that are going to be the best food choices for them? Have they learned how to prepare foods that are beneficial and healthy and health sustaining? Have they done that? Or are they still eating the fast food, but they're eating a smaller portion of it? Or they're eating they're getting the quick fix, but it's just a smaller portion of it. That may not be the answer for you, or that is not the answer for a long-term healthy lifestyle. A long-term healthy lifestyle requires real change, and requires not eating the same way you were eating that got you where you were in the first place. So, can you use these particular medications as a short-term jump start? I don't know. I don't know the answer to that. I don't know if you can go on it for 3 months to get you on the right path. as long as you're getting the support that you need, the coaching that you need, or the therapy that you need, whatever support you will need to change your mindset over the way you were before. Because your mindset before, again, is part of what got you where you are. And until you can change the way you think about yourself, the way you talk to yourself, your expectations of yourself, until you can get to release the trauma and the shame and the blame, until you can get rid of all of that, you're going to be in the same boat. Because if that medication is meant for you to be short term, and you have done nothing to change any of the stuff that I just talked about, you'll be right back in the same boat, and very likely gain the weight, all the weight back and more. But if you do, along with the medication, put yourself into a situation where you're getting the support that you need. You have the community that you need. You have to talk to people who understand. People, maybe somebody who's walked in your shoes. I lost 135 pounds in, I don't know how many years ago, 10 years ago or so. And like I said, my weight is up and down. It's never been up that high again. It's never been anywhere near that. But I understand how that feels. I understand what it feels like to walk in the world as a bigger person. I understand what it feels like to wish you were invisible. I don't like talking about this, and I don't know if I've said this before, but I'm trying to desensitize myself to this story. But in my former career, I was walking into a conference room one time full of people. It was about half full. About half the department was there at that point. I walked in, I sat down close to the front of the room. The tables were along the sides of the room, and I was towards the front on one side. And I went and sat down in a chair, and it broke. And that was the most humiliating thing. And there were a number of people there who saw it. And some of them were not so sympathetic. But it was the most humiliating thing I ever experienced that I could recall. And yet I didn't do anything. That was not the catalyst for me to lose weight. So I understand what it feels like to feel like you're hopeless and not be able to, there's no way out of this. And the only option you see is this little pill. I understand how that feels. Now those pills were not, at least they were not available in I was not aware of them. Not sure I would have taken them even at that time. But I had a much different outlook then. It would have, because I was overweight and just couldn't see my way past the cravings. So it wasn't until I got a diagnosis of breast cancer that I finally realized I better do something, because I wasn't taking the subtle hints. So now the big hints had to come my way, like breast cancer. But at the same time, I was pre-diabetic. And I knew that, but I still hadn't done anything about it. It wasn't until the breast cancer. And the breast cancer was the big red blinking light, flashing light in my face that I couldn't ignore. And that's when I decided to take my health and my life in my own hands. And I lost the weight. I went through conventional treatment. I lost the weight. I lost 135 pounds. And it felt amazing. It felt amazing when I lost that weight. But I also felt tiny in the world. And it felt weird to walk around in a smaller body like that. Because I felt like I just shrunk down. My entire body shrunk down. But I felt really healthy, and I felt, I had no aches and pains. I felt really good. So that's when I decided to take this path and become a board certified health and wellness coach, and help other people, because I want to help other people. And then I sort of morphed into the diabetes area, because it is such a prevalent disease state that is happening more and more. And where it's really terrifying how it's, within 10 years, about 50% of the U.S. population, adult population, will be either pre-diabetic or diabetic, and many of them won't even know it. So that's why I want to help people to overcome this. But that doesn't mean that if you're 10 pounds overweight, that I would recommend that you take diabetic medication to lose 10 pounds, to get into your bikini. These medications are meant for people that are morbidly obese and who have serious health implications as a result of their obesity. So using the drug to take the last 10 pounds off, I stand strongly against. But if you feel like your only option to keep your health, to stave off a critical health crisis is to take this medication. I urge you, if you're going to do that, to make sure you get the support that you need in order to take that weight off and keep it off and develop a healthier relationship with food. And make sure that you are not just using it as a crutch. And I hesitate to say that it's the easy way out, because it isn't. Yeah, it's not easy on your body. But I really would encourage you to seek out other options before you decide to rely on medication. And I'm going to leave you with these last questions. These questions were asked by a doctor on that Oprah special. I watched it. I found it interesting. But the questions are, and these I think I would encourage you to use in your own analysis of whether or not you should use medication. You want to ask yourself, what are the risks of taking the drugs? What are the risks of not taking the drugs? What are the benefits of taking the drugs? And what are the benefits of not taking the drugs? If you would like to have a conversation with me or a free consultation with me, I would love to talk to you about this or anything else. If you want a free consultation, what we do is we talk about where you are, and then we talk about where you want to go, and I give you the steps to go from point A to point B. I help you to determine what your next steps are. If you decide that working with me is something that you can't live without, great. I'll tell you how to do that. But if you feel like you've gotten enough from me, that's okay too. You will get some good action steps to go forward and set yourself up on your healthy path. So you can work with me by going to my website. My website is yourpoweryourhealth.com. And if you go to yourpoweryourhealth.com/book, you can schedule yourself a free consultation with me. No strings attached. We'll have a good chat, and you'll get started on your way to a healthier lifestyle. That's it for today, and I'll be back next week. Have a good day. Bye.
Freedom, freedom.